So I want to just thank you all for coming today. I hope you're all safe. The good thing is that I know we're all going to get through this together, and uh, part of it is going to be the ability to give people the care that they need remotely and digitally, in spite of the fact that we are, unable to see people in person as much as we'd like to with the isolation issues that we're going through. So no better time than right now to engage in the remote care that BodySite is known for. BodySite is a remote care and digital guidance platform that allows providers of any kind, but certainly wellness, healthy lifestyle, um, weight loss, and other practices to guide patients between and after encounters. So right now, for example, when you're not with a patient and you want to give them guidance on how to follow your care protocol, a diet, a mindfulness program, exercise, anything that the patient would love to have you be able to guide them through when you're not with them every day, BodySite is the vehicle for that. And there's a library in the account with all sorts of care programs in the topics I just brought up that you can use to just enroll a patient into a program, and they can follow it every day for a month, 2 months, even a year, and know that they're getting your guidance and that you're touching them. It's also private labeled for your practice. We're going to talk about some ideas on how you might bring this COVID-19 plan to your community today. So the first topic we want to discuss today is, where do you access the Healthy Living COVID-19 plan? Katrina has led my team in getting this plan together. It's a 30-day protocol that is going to be ideal in letting you guide your patients and clients through this crisis. So for 30 days, they'll get a daily dose of mindfulness and healthy eating tips, then also videos on mindfulness. One of the things that we're hearing from most of you, and we know from all the people around us, is that everyone is really stressed out and feeling very isolated or sad or depressed. So we've included a video on the first 21 days. Each one of them is a different topic for mindfulness. And once you get into your account, you can preview this by going to the plans library and clicking on the preview button. And you can walk yourself through all of the content. So just to recap where we are, I've got the preview open. When you log into your account, you're going to land in your account and click on the plans library. Originally, you'll be in your plans. When you click on available plans and templates, you'll see a number of programs. Depending on the size of your library, you might have a whole bunch of these. You can search by the word COVID or just scroll down to templates. In your account, unless you've got tons of plans like our Sandbox account here, this will probably show up at the top of your screen or top left. You'll see a little menu pop up here where you can click to copy and edit the plan, or you can just click on the tile and get here where you'll see the short and long description of the program, where you can also copy and edit the plan in addition to previewing it. Once you do that, once you copy the plan, a 20-second plan routine or plan copy routine will run, and then you'll find that plan will land here in your plans library, where you can see it and then open it, see the sales page if you're going to offer this remotely to people, most likely for free. Edit the contents of the plan, assign it to somebody from right here, or even make a copy of it and make different versions of it if that were appropriate. Link here, you can immediately assign that plan to anyone in your account. So you can search for somebody, or you can put all your clients on that plan by clicking on all of my clients, and it will assign the plan to all of your clients immediately. If you want to go to the edit plan functionality, this again is filled in by default, and you can see what the page would look like if you were to sell this to clients. So here's a preview of what the page would look like. And if you put this on your web page or on Facebook and somebody clicks on the link, they'll see a little sales page like this where the person can actually go to it, get this description of it, and then at the bottom of that page, click on Get Started on the Healthy Living Plan, and they just put in their email address and their name, and they'll get started immediately. So we're going to work with that right now. So if you've got this far, you've already copied the plan, you've customized this information about the plan if you want to. And if you don't, you can immediately jump into listing it for sale. I'm using that word in quotes because you're going to probably be giving this away for free. You'll click here. You'll click on for sale, offer for free unless you want to charge something, and $0 and click submit. Once you do that, this plan is now available for free for you to give out to people to sign up remotely. And you can also sign it within your account. But in terms of getting the biggest number of people to sign up for this, either through an email blast or from social media or on your website, you're going to want to then get this link here, which was created as soon as you listed this for sale. And now you've got a sales page link which you can click on and copy it to your clipboard. And then anywhere you go that you want to share this, you would basically just paste that link, and it's going to bring up the sales page. And
Just one,
go ahead, Katrina.
just one quick note. If you're not yet using Stripe, which is our e-commerce solution within your BodySite account, you won't have to choose sell to clients. There will actually be an option inside of your side that says get public link. So just one differentiating factor is if you don't use Stripe yet inside of your BodySite account, there will be a button that says get public link instead of sell to clients. So you won't be clicking a sell to clients button, you'll be clicking a get public link button.
Great point. Yeah, depending on the kind of account you have, you'll either have the sell to clients button or the get public link button. I just forgot that the account that I'm in, we've already set up Stripe because we show people examples of how to sell their plans. Until you set up Stripe, you'll just see the get public link button. Either way, you're getting that public link that you can then email to people, post on social media, post on your website, etc. Now, one of the things that is really great is using the email campaign. So one of our doctors who may be on the call today sent us an example of what she's sending out to her list. And because of people like this, thank you, Dr. Steele, we have literally almost, I think over 2,000 people have already gotten this plan from a provider. So she sent out a blast to her list with the Healthy Living COVID description, her own graphic, and then she has here, click here to download. It's not really a download, but it brings the user to the sales page where they can then sign up. So it brings them, to her branded version of the sales page, and people are just signing up one after the other for free to join this program. Another example we have is from somebody who did a very simple version of this using the graphic that we included in the description of the plan. They added some bullets and then emailed this to all of their customers with a link. In this case, just reply and we'll enroll you. So she's doing it with an enrollment inside of the platform when somebody asks for it, but you can do it either way. If you send it out as a link, people will be able to enroll themselves, as I showed over here in this example. So if you're giving out this link, your patients and clients will be able to go to a page that looks like this with your brand instead of ABC Wellness, and they'll be able to just click here and get started. So you can have people joining in 10 or 20 seconds without any difficulty whatsoever. Or if you're in your account and you want to add people, you can click on adding somebody by the selling personnel option, the assigned plan option, or as always, under your clients or patients option, just by clicking on enroll a new client and putting in their name and email address here, or as many of you have been doing today, uploading a list of clients with a spreadsheet, and you can do tens or hundreds of people all at once and assign them to a plan, to this plan in bulk. I'll take a breath. Katrina, any thoughts on that?
No, yeah, that's great. I think definitely using the public link or the, if you call it, free sales page link are great options to get this out publicly amongst your community and population. And like you saw in the examples, you can email that, you can post it on social media, you can post it on your Facebook, text message blast, even on your website, you can add a tab for it. In this way, we can continue to expand the reach of the COVID support program.
Right. So you can post this also on Facebook, with this button right here. So if you click on share to Facebook, this will all automatically pre-populate a page for Facebook, which will have all this information here. And then you can also customize that with, your own text if you want to. And I think Katrina gave me an example of that here. Once you click on share to Facebook, you could put in text like this and customize that link. So it's not just the picture of the plan and the name of the plan, but text that speaks to the people that are going to be reading that on your social media feed. And she wrote here, as a doctor, my patients are always my top priority. And she put in some text that you can customize on your own Facebook page. That button, I think, is not as often used as it ought to be, but it's really great if you're on your plan like we are here with Healthy Living. You can use this right now to just click on share to Facebook, and in one click you can put that on your social media. And again, if you want, you can also use the link to paste that anywhere, whether it's a web page, Twitter, anywhere that your LinkedIn page, and you can make it available to dozens or hundreds of people all at once by using those tools. And we do recommend that if you've got a mailing list and you're using a CRM like MailChimp or Constant Contact, and you've got an engaged list of people, you'll be surprised how many people will want to join this program. So just send the link out to them. If you want any help creating an email or just how to do that, feel free to send an email to us at info@bodysite.com, and we'll help you with that. We want to reach as many people as possible with this. Katrina, did we cover all the ideas that we had for the exposure among the population?
Yes, we did.
Okay, so we're looking to impact as many people as possible. Like I said, we've had about 2,000 patients or individuals enrolled in this program already. We're really passionate about as many healthcare providers getting access to this to send it out to their patients and clients. We'd love to see hundreds of thousands of people enrolled in this, because we know just from watching the news and our own social media that there are so many people who are feeling nervous, isolated, unable to go to the gym, unable to go grocery shopping, and they're looking for a little bit of help, a little bit of support. And that's where you come in. I think you guys, the providers of healthcare, whether you're a coach, a nutritionist, a chiropractor, an MD, basically you are the front line of this. And so we really want to utilize you by giving you this platform to reach out to people with this plan. And as you know, there's dozens of other programs that you can give people, but this one's really specific to what people are going through right now with the mindfulness and the other healthy tips for the next 30 days. So take a moment to share the BodySite link with every other provider that you know. If you know somebody in a different state, a different town, who practices medicine, who sees patients or clients and gives them healthcare advice or wellness, or that they should be, send them to BodySite this week, today, tomorrow, and let them know that they can and should be touching their population with this help. It's free. We're offering it completely free for the month. We want as many people as possible to use it, and we'd like you to share the platform. They can just go to bodysite.com/COVID19. So if you want to share that link, it's bodysite.com/COVID19, and they'll get a little bit of an education on what we're doing with this program, in addition to the emails that we've been sending out. That's all I can think of for now. I don't want to keep you much longer. I'd like you to get back to what you were working on, or maybe just being with your families. I want to just check really quick if we have any questions here. Looks like in our chat, we've got a bunch of just comments. I'm going to just go through these.
I'm handling them all right now, but if anyone has any other questions, feel free to submit them so we can address them for you guys and before we end the call today.
Great. And I saw one about communicating with the patients once they're enrolled. I think it's really important for anybody who's on the call today who's not already using BodySite to realize that the platform is not only going to allow you to push information to people who you enroll in your account, but they'll be able to message you with questions unless you turn off that function. So it's a great way to also open a conversation where you can coach people through the platform. And if they choose to use the other functionalities that we have in the platform, like the journal, the photo gallery, the the tracking of food, body metrics, and activities, you'll be able to have a conversation with them around those biometrics, activities, and things like that. So there's a great deal of other functionality that I'm skipping over right now because most of you that are on the call are already using the BodySite platform. But if you're not familiar with that, please realize that the patients and clients that you enroll will be educated and supported through the push of information that you're going to give them by enrolling them in this plan, but they'll also be able to engage in dozens and dozens of other really cool functions on the web and in the app that bring you closer to them in sort of a feedback loop between you and that patient. And that's it. Please share the platform, bodysite.com/COVID19. Let's see if we can't touch 100,000 people before the weekend. Each of you has the power to do that in your own communities with the Facebook, the other social sharing, LinkedIn, anywhere that you can think of to share this. And if you need our help, just email info@bodysite.com, and we'll be happy to help you get this out there. And we look forward to any questions that you have. Katrina, anything else you want to bring up from chat or otherwise?
No, that's good. I have a couple people. I'm going to send some follow-up emails to you. Dr. Johnson, I will send you those check marks emojis for you so you have them for your Facebook post. And if you guys need any other insight or ideas for Facebook posts, feel free to email me at katrina@bodysite.com.